Okay, we're recording.
Okay.
All right, so we're here with Dr. Whitney, and so thank you for both of you for allowing us into your home. So I'm just going to start off with a couple general questions. And first, in terms of where you went to medical school.
I went to medical school, Temple University School of Medicine in Philadelphia.
Okay, very good. What was it for you? Your interest in medicine. What led you to the field of medicine?
I came from a family of ministers and missionaries. My father, my grandfather, my brother, my sister. I was under some pressure to do the same. I decided I would rather devote a life to service. And I picked medicine. That's the reason and I tried to practice medicine as if I were a minister.
Very good. And when did you start practicing in Delaware?
I started practicing in 1950. And the reason I came to Delaware was that I had trained with Philadelphia we were familiar with Wilmington because students used to go to Wilmington hospitals to substitute for residents.
Right.
And so we began to come to Wilmington in 1942. And the greatest interest to me at the moment was the fact that the hospital was run by the physicians. The licensure was strange. You had to be a citizen of the United States. Delaware had no reciprocity. You had to take a 3-day exam in which anyone could fail. And then if you had a recommendation from somebody who was a member of the medical society, they would consider you for after you passed the examination. The hospital programs were run primarily by physicians, which is different than what we do now today. In any of the 3 hospitals, there would be somebody in charge, usually a chief of surgery or the chief of medicine. All of the appointments were temporary. You're given a 2-year privilege in exchange for which you would serve the hospital for no expense. And that continued. At the end of 2 years, you'd be reviewed and reappointed. Now I think the hospitals are run by businessmen or businesswomen. So there's been quite a change. But I was attracted here because there was we trained at Temple, and the leading position was Dr. Babcock, who introduced many new things in the care of patients. His friend was a fellow by the name of Dan Preston. And Dan Preston wanted an assistant, so I came to work with him for a year. And he ran me ragged. But at the end of that time, I wanted to practice for myself. And I noticed that there was a wealth of information there. The tradition of Delaware in healthcare was that a great deal of attention was given to the poor and the needy. So that the first nursing home, for example, was Kentmere, Home of Merciful Rest.
Yeah.
You could be admitted there and spend your life there. No cash, no express. The moneyed people went someplace else for medicine, for care. They went to Pennsylvania, they went to Texas, or they went to
Florida.
yeah, brothers. However, there was plenty of material here for treatment, but they didn't have a residency program. They didn't have good training programs. I was here about a year when a man from Philadelphia recommended that they appoint me as director of their cancer program. Okay. At that time, St. Francis had a surgeon who operated, paused in the middle of his operation to have a cigarette, and then went back to his operation. That really astounded me. Wilmington General had good service. Delaware had good service, and we had an osteopathic hospital in town. But we weren't taking advantage of the capacities that were there. So I started as running a tumor clinic, and got full support, really, from the medical society and from the hospital programs to push forward that. At that time, cancer was not reportable. So one of the first things we did was to make, with help from the medical center and others, medical society and the state, to make cancer a reportable disease, which started a system of tumor clinics, tumor registries, and that began to keep track of what we were doing. We had an idea that we ought to be able to provide service at home. So the concept of excellent care at home became the driving force, really, for most of the development over the next 20 or 30 years. The approach that I used was to begin to take advantage of local and national organizations. So the first thing we jumped into was the American Cancer Society. Then we began to work with the Medical Society of Delaware. Then we joined any group that had anything to do with medical education, and began to deal not only with local people but central people. So we tried to promote Delaware as a place, a good place, and this involved things like the American Board of Surgery, the American Medical Association, and we had some help from a lot of people locally. I remember that Dr. McGuire from Newcastle was vice president of the American Medical Association. So we began to interject this state into the concept of good care. And we found out that you could get better results if you dealt with the central office. So we got into the Southern Medical Association and a lot of the organizations that helped develop. We also began to talk with the people who organized and approved the residency programs. Very shortly after that episode, in the first 8 or 10 years, I got to be president of the medical society, of the medical center at Wilmington General. The programs that developed had to do with cancer primarily, and education primarily, and research primarily. And working with the centers of excellence, we got to be visible in the national eye. The thing that really sparked the imagination of the people here was the concept of merger, we realized the potential for care if we could get better utilization out of our services. So I don't know what year it was, but we brought about a merger of the three hospitals, three major hospitals, excluding St. Francis.
That was about 65 or so, wasn't it? Less somewhere.
Just about
around.
65.
Yeah, yeah.
And it caused quite a stir because none of the central organizations would recognize us. They said, you can't, we said we would like to have a surgical department, single surgical department with residents. You can't do that. So we get in the airplane and go to Chicago to talk to them. And shortly thereafter, everybody in the country is doing it, right?
Yeah.
They're merging all over the place.
So they were against 3 hospitals forming
That's right.
one department.
They said you can't control that kind of a program. I said, why not? That was the first big step that we got approval for residency programs.
Why was St. Francis left out? Did they not want to get involved?
I don't know the answer to that, except the maneuver seemed to be centered around not the Phillies, not the DuPont, and the
DuPont Company?
yeah.
Yeah.
And most of the board were DuPonters.
Yeah.
As a matter of fact, Irenae said, I don't want to have anything to do with it, and slipped off and started Wilmington College,
Yeah.
which is a real big deal, but that's beside the point.
Yeah.
The fact is that by coordination, and this involved everybody, including the medical society, the other hospitals, we had them involved through the Dimer program. The Dimer program was a great idea, and I don't know who thought of it. I'll tell you that it was a statewide program. It was chartered by the state of Delaware. It had 9 members in its board, and it had a great deal of power, but no money, no real money, except about $1 million a year or something like that.
From the state.
It's a state, yeah.
State money.
State money.
Yeah.
And they had a board made up of people from Wilmington, the new hospital arrangement, and the University of Delaware.
Yes.
Yeah.
I was on that originally.
And you were on that, yeah. And that was very effective, but it ran. It didn't meet all the standards that they wanted to meet, and they got angry, and changed it. It's still operational, but it had to do with strengthening the programs, all care and medication and education and research in the state. It benefited everyone.
Les, I remember with the hospital merger that Norman Cannon was very much involved in that too.
They had
Did you work with Dr. Cannon?
I worked with Dr. Cannon, and I worked with, yes. We tried to do what they wanted done, and
Yeah.
I think I think it was established probably because of the cost of care, and also had to do with cancer care. Because the big argument was the only thing they had to treat this cancer with was radium, and who was going to get the radium? Okay, Wilmington General was going to get the radium, The movers and shakers then got together and said, we're gonna have to consolidate this and save money and improve the whole system.
Yeah.
So as time went by, the Wilmington General got torn down, and the Memorial got torn down.
Yeah.
And St. Francis was not involved. Now, where was I? All right, questions?
Okay, you were talking about the Dimer program. Let's go back to this Department of Surgery at the hospital. You became chief of the department.
Of the first, yeah. I
Yeah,
was
you were the
chief.
first chief.
Yes.
And tell us about how getting that together, just getting all the surgeons to come together.
Well-
Was that difficult?
No, it wasn't difficult, but I fudged it. We surgeons, Gelb and Glassman and
Yeah.
Raffel and May and
Richards, yeah,
Richards
yeah.
formed the first association, surgical association in the state, and worked out how we would operate. So then I took the position as chief of state, chief of surgery. I was accused of being, what did I do? I offended everybody else. I held a position which was, it's hard to mention this now. There was no salary involved. It was a labor of love.
Yeah,
And I served for 8 years, and then I thought it's time for someone else to do it.
How many hours a week were you spending on this? It's to take something from nothing and make it, to develop it takes time.
It took about 15 hours a week.
15 hours a week of your own time with no,
So they developed a system so they were able to replace me with considerably more than that. But the best thing that came out of merger, as far as I'm concerned, is the establishment of what's now Christiana Care. And I was on the board and the financial committee and the place where we're going to put it.
yeah.
And we finally
location.
decided on 200 acres,
Yeah,
which accompanied.
I remember a good deal of controversy to stay in Wilmington or to go to Christiana. And there were two opposing camps, as I remember.
Well, that's right, and I can understand why, because everyone was very proud of their own organization.
yeah.
And I happened to be involved with all three in a position of leadership. So that's why I became the spokesman for the surgical department.
And somebody gave you some land too, didn't they?
Oh, yeah, they gave me
That helped.
200 acres of land and a place to build, yeah.
Yeah, that kind of helped a bit.
And that was the Longwood Foundation.
Now, as they began to develop the plan, I noticed that they were leaving out some important things. There was no provision for cardiac surgery. Cardiac surgery was right at the,
Yeah,
just coming in.
yeah,
We were sending 200 patients a year
Yeah.
to one of the Philadelphia hospitals. So they changed the plans and built a operating room that would accommodate cardiac surgery. Then I noticed that they had no provision for doctor's offices. So we put a group together that set up the organization and began to build the offices. They're now, I don't know what that is, the wing off of.
so you were a leader in the Medical Arts Pavilion.
I would say so, yes.
I did not know that.
I required I said, you know, this, you only get one chance to do this. And I think that, they caught on
Yeah,
that you really, you've got to build for the future, you don't build for the past. So I think that's why we've got now one of the finest organizations in the country. And if you look at the reports, how it stands, it's about the 8th largest
Yeah.
organization on the East Coast. It's the top 100 and all the rest. They brag about all sorts of things that are really true. But I want to point out that we got a lot of help in all of the other hospitals. In other words, we raised the care. BB, which had a long tradition of good surgery, got even better.
Yeah,
And the rest of the hospitals just,
help the whole state.
yeah,
and the medical society helped a great deal. One of the things that I did was I wasted $60 million. I confess. I didn't realize that all information was going to be transmitted without wires. And we were working on a system to allow for transmission of information from one hospital to the next hospital on telephone lines. So we even had an corporation that would help build a reception room.
yeah.
You know, there's one at your hospital.
Yeah.
There was a young doctor down in Seaford, I think, that said, "You're crazy. All this is going to be line of sight transmission. No wires, no nothing. Just."
Yeah.
I
Through
couldn't.
the air.
I
Yeah,
couldn't believe it.
yeah. There was a committee that Mark Meister formed
Yeah,
with the hospital
that's right.
to initiate that.
Yeah.
And I was on that committee. I don't know what the hell they were talking about. When they were talking about the
We were talking about telephone.
yeah, the
transmission.
internet and the like. Yeah. So you were ahead of yourself then in
Well, yeah,
getting that.
but I was wrong.
Well, you were still thinking of wires.
Yeah, we were
Yeah.
still working on, and we had a system that we used several times that came out of Wilmington, out of Philadelphia, over the cell phone.
Yeah,
There was a group that did that.
yeah,
And you could broadcast, but you had to have a reception room, a machine. We raised some money for that. Yeah. You got some questions now. I'm
Tell us about the residency program, how you started that.
which?
The surgical residency program.
Oh,
But there was none when you started.
well, I tell you, they had a beautiful suite on the 5th floor for residents.
Where?
At the what was then the Delaware Hospital.
Delaware Hospital.
Yeah,
They had a laboratory where you could do experiments on animals.
Oh, my goodness.
But
Now, who set that up? Were you involved in that?
no, I was not. I was there when I got there. But
Oh,
what we did at the Wilmington Hospital one year, we started the year with no residents.
yeah. Because I remember there were medical interns, and I think there were medical residents.
Yes,
Were there no surgical
well, there were a
residents?
few. They came and went.
And who was responsible?
Well,
Who
I'll
did they
tell you.
report to?
We discovered a source offshore.
yeah.
We got a fine surgeon from Great Britain. We got people from South America.
Yeah.
And then we got some Americans. But as soon as we got rolling, we could attract them because we had a good system of recruiting, and we treated people nicely, and they'd like to come. But Actually, the man that helped me the most was a Greek from, no, Turkish.
Is that Dr. Oz?
Must have Oz, yes.
Uh-huh.
And
I think when I came, he
Was it-
was head of the residency program.
he was my assistant,
Yeah, yeah.
and he was ingenious. By that I mean that his practices were not exactly pure, but he knew how to get things done. And on the side, he was selling, I won't get into that.
Okay,
No, I
yeah, I
think-
think.
Yeah, we'll let
Yeah,
that
yeah,
one go. It's all
yeah,
good.
Yeah, yeah. And
It's
of
all
course-
good.
And of course, his son is now world famous.
But he responded to me the way I wanted him
Okay.
to.
Yeah, yeah.
And he was reliable, honest, honorable.
You were in charge.
Unless many of the people that you train stayed in the area.
They did.
On the
That's the other
staff.
thing that happened. They would open up and you see what you must remember, you probably weren't here at the time. We didn't have any pediatric surgeons. So we used to have to send all the people to Philadelphia, so Dr. Richards and I went up and learned how to do pediatric surgery from the master there. I forget who it was now, but we had very few orthopedic surgeons, so I did a lot of reductions. I didn't do any operative or surgery, except I nailed a few hips. Let's see, we didn't have many gynecologists, really.
I'll ask this question. When did you form relations with the Alfred I DuPont Hospital and Dr. McEwen?
Gee, I just met a good friend over there, that's all. I didn't have any real official appointment there, did I? No.
Well, we didn't do trauma at that time, you see, so there was not the overlap that there
As
was.
soon as the orthopedic surgeons came, now we did sell them our pediatric service,
Yeah,
which was one of the things
Yeah,
I had to do
yeah.
with it. And that became a wing of Jefferson.
Yeah.
And one of the most important things that I can report is my affiliation with Jefferson.
yeah.
Yeah, tell us about the Jefferson
And the
affiliation.
start of it.
Yes.
Well, the Jefferson was part of the Dimer program.
Hmm.
And what
Tell us what Dimer meant.
Dimer, Delaware Institute of Medical Education and Research, with a great big, what you could do. And we had a director, and we met on a regular basis, but we were charged with developing a relationship with an established medical school. So we went to Johns Hopkins and we went to, I don't know,
Penn or Temple.
Temple.
Yeah,
We went to Temple, we went to Jefferson. Jefferson said, "We'd like to work with you." So for a fee, they granted us 20 Delaware students every year, if they met the requirements. And that operation is still in effect, that relationship.
And wasn't the key thing that those individuals applying to Jefferson competed only against other Delaware residents for those slots?
They had to be Delaware residents, is that what you said?
Yes,
Yes, they did.
and that's what made the program
Yeah.
so popular.
And they were supposed to come back and practice
Yeah,
here.
we're supposed to, in exchange for the return
Yeah,
for practice.
Yes,
And one of them is now running the hospital.
yeah. I didn't know Janet Noyes. Would you tell us, because my questions will be edited. Tell us how a Dimer resident student became the head of the hospital now.
How they got to go to Jefferson?
Yeah,
Well, they applied, they applied like anybody else.
but you would compete only against Delaware residents, is that true?
Yeah, yes,
And that's what made it
that's right,
more attractive,
that's right,
instead of competing against 2,000.
that's right.
Yeah.
You had to be one of the 20.
Yeah.
Right? One of the,
It would give you that in-state preference,
Yes.
right?
Yes.
what was that question?
Yes, it would give you that in-state preference for,
Yes,
as a
that's
candidate.
right.
Yeah, yeah.
So we had meetings with them on a regular basis. Their whole staff would come down for dinner. And we'd talk to them about what we had, what we were selling and how we were doing it. And now I understand that we've got a class of students, third-year class at, I can't keep up with them.
No, I
But
can't.
it's been a very, very useful program, totally supported by your organization and funded by the state. And that.
Do you see it as a great thing? Did it help a lot in the development of medicine in Delaware, the dimer?
Oh, yes,
Yes, that's
it
what
did,
I,
because most of them came back and we funded them with money that was to be returned as time went on. And of course, we got into some discussion about that. But we had help from the medical society in reviewing the applicants when I was there. Qualified, we wanted to be sure they were qualified. Aside from that, nothing much happened.
how about the blood bank where you
Oh, I
were?
want to tell you, yeah. One of the things that was holding back surgery in the 40s was lack of adequate blood. There were other things I'll mention. Through the Blood Bank of Delaware, which I managed for a while, we developed a program to provide blood for the entire peninsula, right down to the.
Yeah,
right
right
down.
into Maryland.
And it's been very successful. It's been in competition, of course, with the blood bank, with the Red Cross, no. The American, what's the national group? Well,
I'm not
anyway,
sure, go ahead.
that's one of the things we're proud of. The other thing is that we didn't have good anesthesia in the 40s. So we got a man from the Veterans Hospital to run our anesthesia department, who developed the endotracheal tube, which changed.
Who was that, Les? I don't remember. Okay, we can, I'm not sure there.
Well, it'll come to me in a
Yeah.
minute. I've got one of those pictures hanging in my wall. It was,
Okay, I don't remember.
Saunders, yeah,
but I can get it for you. It's,
Saunders.
so it allowed us, the lack of blood changed the care of a lot of people. A bleeding ulcer could have 2 units of blood, then you had to do something about it because you ran out of blood. What's happened is that we no longer operate on bleeding ulcers.
As I remember,
They
John.
put a tube down.
Yeah, yeah. As I remember, John Egan was recruited to come here to head the blood bank.
That's right.
Do you remember
I
how?
remember that we convinced them that they would do better to let us run it.
Yeah,
Manipulations. No, they call them negotiations.
yeah,
But it's one of the finest blood banks in the
yeah.
country.
It has a marvelous reputation.
But it's a regional one, it's not just stuck in one place,
Yeah.
right?
Right. What else?
Were you proud of the residents that you trained and watching them develop?
Oh, yes.
Tell us a little about that.
Well,
There were many who were,
most of them are
Yes.
still practicing it.
yes,
Of course, a few of them went off. One went to. See, one of the things we did was we improved all the programs. We improved the emergency room. When I started, we covered the emergency room from home.
yeah,
They call you up and say, "We got a head problem, come on in." This whole business of EMS, of emergency system, with a corporation and a service, and educational programs and residency programs, started because the load got too big for us to handle. And we were doing it for free. We were doing it to maintain our appointments.
As I remember, the emergency room was staffed by private physicians who were on a rotation to cover the
It is
emergency
now,
room.
but they incorporated.
Yeah. But there was no Department of Emergency Medicine. When did that start? Do you remember?
Yeah, that started when they got together. One of the things we developed, I'd like to remember this, we developed a training program for the clergy.
Hmm.
We developed a training program for the pharmacists. We developed a program for the nurse anesthetists. And we supervised the programs at the Del Tech in the 4 or 5 ancillary services, like X-ray technicians and
Yeah, I was involved with the physical therapy
Yes.
program that started at Del.
And then we also supported the nursing program at Delaware the College of at Delaware University.
Could you pause for a minute? Who was the guy the Irishman who was head of the emergency room? I've got a blank on his name. Remember? He was the one, I think, who organized the ER and started the training for the paramedics and the like.
I really can't remember.
Okay, neither
But I
can.
remember one went to the University of Virginia
Yeah, but,
to run their education.
yeah, I've forgotten.
We spun off 4 or 5 directors of
Yeah.
emergency care.
And tell us we can go back.
Sure.
Tell us about the start of getting the surgery residency program certified.
Oh, there was a great pause. I didn't mention this. We got word one day that they were going to close down our entire program. All of our programs. We got this from Philadelphia, from Chicago. So, gosh, I hate to tell you this. We moved the director north, sent him up to Jefferson, and I took over the program. And the only thing that I did was I read the manual and did exactly what the manual said.
Great.
They didn't even have a committee. I didn't realize that.
So that was the start of the certification of the
That was
residency program?
No, that was the continuation of the
Yeah.
program. They were gonna shut out down every
Okay.
program we had. And by the end of the 6 months, they came and inspected and we got-
Because you filed the book.
yeah. If you get a new instrument, read the book. I've been doing it all my life. That's a high point, because that would have crushed the whole development,
Yeah.
including probably the expansion from Wilmington Medical Center to Christiana Care.
Was there much departmental rivalry, medicine, surgery, pediatrics, or did you all work pretty well together?
We all worked pretty well.
But you mainly stayed in one hospital of the three, didn't you? They stayed at the General, or they stayed at Memorial, or,
Well, the big hospital all along was the Delaware,
yeah, there was one certain number.
because we'd been working at it a long time. And had,
And then did you not, of the three hospitals, say all the orthopedics was done at Memorial? How did you work that
yeah,
out?
we began, we changed obstetrics, went to the Wilmington General.
Yes, that's, yeah.
Let's see, what were they doing primarily at the Memorial?
Orthopedics, as I
They were doing a lot
remember.
of orthopedics there. But they expanded to meet the needs. When joint replacement became important,
Yeah.
they put together a joint place and a rehabilitation service. So they had a system. They took them in on Monday and sent them out on Friday. Usually.
Yeah.
These were knees and hips. And,
Les, if you had to pick, say, three things, what would you be most proud of what you achieved during your career?
Gee, I can't answer that. I tell you, I am really impressed with the fact that I had the opportunity to do this.
Yeah,
Mm-hmm.
you were in the right place at the
That's a
right
good
time.
answer. Yeah.
And I did, well, there's so many things that came about. I think that I've often reviewed in my mind whether we did the right thing by moving pediatrics over to your place.
Yeah.
But I think it was good for Jefferson, and I think it was good for you, and it was certainly good for
Yeah.
us.
Yeah.
Because we then concentrated on prematures. And that took a real effort,
Yeah.
That premature.
Let's pause again. Are you getting a little tired, Les? Do you want us to end this? Do you want us to end, or?
Oh, I can go for it.
Done okay? Actually, I have a question for you.
Yeah.
So the practice of medicine, what does the practice of medicine mean to you? And what has it meant to you? I know it's kind of a big question, but
Well, it's occupied my entire life. It's satisfied my family, the preachers, the missionaries. It's given me an opportunity of knowing some remarkable people, some of whom are here. It's given me an opportunity through involvement with a number of things. See, one of the things that I did, that I'm proud of, was I ran a program for the American Cancer Society and for 10,000 women. I don't know whether you can picture in your mind 10,000 women through a mammography program to develop systems that worked and to find out whether it was worthwhile the effort. We ran that for 8 years. I'm very proud of that program because it was one of the best in the country. There were 26 of them, and we were among the top 5 in results and reports. I think the fact that Christiana Care has a conscience. This is a fair statement.
Mm-hmm.
They've gone way beyond me on this. I love everybody angle, but being kind. they've developed, for example, a system of linguistics. So you can call on anybody you want to interpret for you because they're available. And I think they're constantly trying to improve their standing in the nation, and I think they're doing very well with that.
Les, you have put an awful lot of effort into all this, and you really worked at it, and you kept thinking, how would you take a young person and get them to follow in your line of trying to really look at the big picture rather than just at the very small picture? Because you were looking at the blood bank and the different things. You were looking at it in a broader sense than most people do. How did you?
Well, you know, it's hard to tell that because the whole practice of medicine's changed.
Oh, I know that.
So that it's no longer a personal responsibility.
Well,
See, when the only guy who accountable for me was me. If I didn't do what I was supposed to do, I couldn't stay on the job. And that meant total care for patients, 24 hours a day. That no longer exists. You get a shift and then you go home.
well,
So what I tell my kids, do the best you can. And I think that's my advice. And learn how to be reliable. I think that's,
well, there you go. How do you do that?
I think it goes back to why they're in medicine. You know, I've had contact with a number of missionaries. And some missionaries are really heroes to me. The people who go into dangerous places to give a service to people that they don't have to do, and do it for a lifetime. I think if you begin to sell medicine as a service, not as an occupation, I think you say, what's the difference? The difference is one of personal responsibility. And I don't know that we're going to do that. They're beginning to reorganize the educational programs, you know, to make it more, I don't know,
Yeah, broader, more community involved.
worry about everything
Yeah.
that you could possibly worry about and see that it's cared for. But we certainly need that when you think of the people are on drugs and the reason they're on drugs.
Yeah.
So I would say it has to do with personal integrity, that's all.
Les, I hear fellow physicians talking about not wanting their children or close friends to go into medicine, that it's no longer a noble profession, and that the stresses that doctors are under.
Would you like to try to make it better? I don't know. You're right, and I'm not sure why they go in, but I think it's different. And one of the thing that makes me different is the population of medical schools now is 50-50.
Mhm.
And the best students are women. They're knockouts, really. They're just great. Because they seem to be able to run a business and a life at the same time. I'm not sure that the men can always do that.
You have a granddaughter going to medical school. How do you feel about that?
I'm delighted. I think she's going to be great.
And I imagine you felt the same way when your son went into
You
medicine.
know, she's already been to South America. She's already been to the Canadian Rockers. You'd be surprised what she's done so far.
Mhm.
outside of school. I think she's gonna be a leader once she gets through it. I think Christopher comported himself in
Yeah.
a good way. He was an honest surgeon.
Yeah.
And I think that one of the things that kept coming up in my mind is, why am I doing this? Is it because I can do it, or because it needs to be done? Now, somebody told me that if you give a surgeon an instrument, he's going to use it. And that's true. And he's going to use it whether it's really indicated or not. And now he's going to use it because if he doesn't, the lawyer's going to pin him down for not using it. What? Did you have a MRI? No, why not?
Yeah.
And I think that's driving a lot of care at the present time. You know, it's not
That's the
expensive.
business part of it.
Yeah.
Yeah.
Shall we stop? Shall we end?
If you can answer the question, you're doing this because it has to be done, or because you can do it.
You've done a wonderful thing in your career of looking ahead and seeing how the thing can develop. And
It's been a pleasure listening.
Admire
to
you
you.
so much for being able to do that.
Well, thank you.
In so many different areas. It's wonderful.
I was given many opportunities, and I'm delighted to have two of my old friends here today.
Well, good of you to do
And
this.
no
for
one.
us.
My pleasure. And I would just ask, is there anything else that you'd want to share with us that maybe we didn't touch on? But you covered a lot of great information, but
Sure did.
is there anything that you just would like to add? A parting thought, if you will.
No, one of the things that has interested me is the rapid growth of national organizations. The most recent one